Planet Vero Studio is powered by the Nolan Group of Remax Associated Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicky Soulet.
Hello there, and welcome again to Community Conversations. Every week we sit and ponder who should we ask to come on to our show. And there are so many wonderful people around our community that we partner with. But we've got some things going on internally that I wanted to share with you, as I do weekly with our own staff. So I've brought 2 of my staff members here, and we're going to talk about pharmacy today. Now, don't everybody go clicking me off the dial. There's going to be lots of great information here. A variety or potpourri, as it were. So, Ken, you've been here before. Ken Zielinski is one of our pharmacists. And Ken, you are working at what location?
Working at the Fellsmere location.
Okay.
512. On
512, way out in Fellsmere.
Mm-hmm.
And you have quite a commute then.
Oh, yeah. It's a good commute, but it's worth it.
Ah, isn't that sweet? And with Ken today is Jalecia Chambers, a registered pharmacist assistant. Correct. Okay. I said it's tough on Mondays sometimes to get my thoughts together. So what do you want to tell us about pharmacy, Ken?
Well, we wanted to talk about some of the programs that we offer in the pharmacy. In addition to that, one of our new locations is going to start opening or have their pharmacy be open.
Yes, all eyes internally are on pharmacy services these days because for many years we've only had 2 locations, one at the north end in Fellsmere and one at the south end of the county in our Oslo Road location. And so we recognize that while we're not a long county like Brevard is, nonetheless, for those that live in more centralized Vero, Gifford, Wabasso area, you have to pick which way do you want to drive for 10 or 15 minutes. And our belief is that we not only provide health care for all, but we remove barriers to that care. And so we're all very excited behind you opening up this next week. So will that mean that some of our staff will be shifting?
Actually, yes. One of the pharmacists that used to be at the Oslo location, she's going to be Deandra. She's going to be taking over as a pharmacy manager in Gifford.
Wonderful.
And it's great because she's one of the most senior pharmacists we have, and she's been with us a long time, does a great job, super sweet. Everybody's going to love her.
And so who will replace her at Oslo then?
Steve Valley.
And Steve's been working there now for a bit.
Yeah, he's been there for about 3 months, I think.
Okay.
And, but he's a great guy. He's super nice, and everybody.
We have the best staff. I'll be the first to admit it. Okay. There's no doubt in my mind. But I personally am looking forward to seeing the new window go into Gifford Health Center for the new pharmacy and being able to pick up my refills there for my family. So I know that pharmacy has done a number of things, Jalecia. You've been out and about more than ever before. So being a pharmacy tech is more than just counting meds and telling the pharmacist what to do on occasion, right?
Oh. Yes, it is.
So what services are you offering as part of your team?
I help the pharmacy director. I'm like her right hand, and we actually do a lot in the community to get the word out about TCCH and the pharmacy and our different services. So a bunch of you may have seen my face or some other TCCH pharmacy staff out in your community, just going over different health-related topics and giving out what we call goodies. Freebies, yes.
And Ken, where do those come from?
We have 2 sources. Direct Relief is a big source for us. We get prescription drugs and over-the-counter products. Another source is AmeriCare. We get products from them, over-the-counter products that we just give away for free. You know, all you have to do is come in and ask for them, and
wow,
you don't have to be a client, you don't have to be a patient. You can just come in. If something is needed for the community, we want to provide that for them.
That's awesome. I know I had heard of AmeriCares in relationship to additional staff members. So them providing medications is a newer addition to their services across the United States.
It's really it's a valuable thing, and way people can take advantage of that too is coming into the clinic and getting into seeing a health navigator to get on sliding scale, do these things that they can increase their scope of care and not have it cost anything, which is great.
So that's a really good thing for you to bring up. Our health navigators are not only responsible for sliding fee scale, that is, figuring out based on the paperwork that people bring about their current income and their family size, what kind of reduction in costs we can give out to them. But they also will help people with Medicaid enrollment. They can do a referral for the marketplace insurance, okay, or do it themselves in terms of helping people. And I have heard that the marketplace insurance costs have gone way down. So in addition to President Biden extending that sign up into the summertime, they've also been able to reduce the cost, and people are just pleased as all get out that they can get both of those things. Because while we give a sliding fee scale, the marketplace insurance will cover them at lots of different places, including specialists that might not offer those discounts.
Correct.
And so that would also apply then to any pharmaceutical products, any prescriptions then that the physicians would order. They would also get a discount based on their sliding fee scale?
Yeah, a discount even up until including free.
Yeah, free is a good word.
Free is a really good discount. Yes.
Because everyone says, meds are so expensive. I can't afford to take my medicine. I break them in half, or when they're gone until I get more money in. What's your take on that, Ken?
Well, compliance is the key to, health. And for somebody to continue to be compliant, if it's due to the fact that they can't afford something, it's really a shame. And people need to understand that there's products or there's programs out there that they can take advantage of to continue to stay healthy.
Okay. So some of the things that we're seeing on television now, it seemed like 10 years, 15 years ago, everything was a car or truck commercial. And now it seems like every other commercial is about medications. Many of those are very expensive because they're brand new. They're still under patent,
Correct.
Which gives them exclusive rights to sell it. So how does our pharmacy handle information about that or requests for that?
Well, we have a lot of medications like that through the manufacturers. They have what's called a PAP, or a patient assistance program.
Okay.
And we can print up documents and get the patient signed up and ready to go with the manufacturer. And if they qualify, the manufacturer will send them 3, maybe even 6 months worth of medications directly to their home. And if it's something that may be temperature sensitive, they'll send it directly to our pharmacy. And then we can contact the patient and just say, your medication is here, come get it.
That's great, but is it hard to qualify?
Actually, it's not as difficult as people think. You just have to fill out some paperwork, a little bit of financial information. The doctor has to fill out a small portion of the paperwork, and it gets faxed right to the manufacturer of that particular medication.
So what are the most successful applications that you're seeing for what meds?
Insulin.
Oh, I'm so glad you said that word, because I was thinking this morning, I wonder if insulin is as expensive as they were talking about for some time.
Insulin is very expensive. So we do encourage our patients who may be uninsured or underinsured to fill out the patient assistance application. From what I've seen personally working in the pharmacy, I will say 9.5 out of 10 times a patient will be approved for that.
That's awesome, because that is a life-saving drug.
It is.
That is good news.
In addition to that, through Direct Relief, we get a lot of pen needles, the syringes, alcohol pads, so their
all those
entire
supplies
can be totally free.
Oh, I'm so glad you guys came to talk about this. We're going to take a short break, though, and then we'll come back and we'll have more conversation about different things that are happening in our health system. Treasure Coast Community Health is the only federally qualified health center in Indian River County. This means we have incredibly high standards of care and we waive Medicare deductibles. We serve our community with primary medical, dental, and behavioral health care. On-site pharmacies make TCCH your one-stop medical center. It's time to start returning to life. Spring into action with TCCH, a nonprofit. Get your COVID-19 vaccine and schedule your annual medical and dental appointments. Call us today.
The boom is back. Boom on the Lagoon. A day of music, fun, and fireworks. Presented by Mulligan's Beach House, the city of Vero Beach, and Indian River County. The fun starts at 5 o'clock on the 4th of July at Riverside Park in Vero Beach with music by Johnny and the Blaze, food trucks, and contests galore. Festivities are brought to you by Navigate Restoration and Evergreen Media at Idea Garden. Boom on the Lagoon. The 4th of July fireworks celebration at Riverside Park in Vero Beach.
New Vision Eye Center provides world-class eye care on the Treasure Coast. To tell you more, here's Dr. Robert Reinauer.
Many patients are under the impression that floaters in your eyes are a condition that you have to just accept. Floaters can spontaneously appear as part of the natural aging process, and they disrupt your clear vision. Some have had a laser treatment that does not remove the floaters. At New Vision Eye Center, we provide the latest techniques in the permanent removal of floaters in your eyes.
Dr. Robert Reinauer with New Vision Eye Center exclusively performs this proven procedure to remove annoying floaters in the eyes, providing world-class care for macular degeneration, diabetic retinopathy, and retinal surgery. For an appointment, call 772-257-8700 or visit newvisioneyecenter.com. Make the move to retinal specialist Dr. Robert Reinauer at New Vision Eye Center in Vero Beach.
And welcome back to Community Conversations. This is Vicky Soulet, the CEO of Treasure Coast Community Health. And today, if you're just joining us, we're talking with a couple of our pharmacy team. Ken, who is a registered pharmacist. Ken, you've been with us, 3 years?
For just over 3 years. Yeah.
Yes, it's been a great ride so far. I hope we make to 30.
I hope so.
Or maybe I should say Jalecia make 30, although you've been with us a lot longer than 3 years.
Yes, September will be 5 years.
Yeah, congratulations. So Jalecia is our pharmacy tech, and each one of our pharmacies, now to soon be 3 as we open up one in Gifford, has a staff member that's paired as a team, and so where one goes, they tend to go. Although, Jalecia, you don't have a regular home. You're kind of the multi-faceted gal with your experience.
Yes.
One of the places I saw you was in a Treasure Coast Community Health vehicle the other day. Were you delivering medications?
I was. We do offer in the pharmacy free delivery and mail order for patients who just want it. Even if you are not homebound or anything and you just don't feel like coming out, we'll get it to you by pretty much any means necessary.
That is awesome. Now, do the prescriptions for mail order, are those primarily at 90-day, where the doc writes for 90 days worth of meds instead of 30?
It is for actually whatever the doctor writes it for. So even if it is 30, we'll get it out to you every month. We do try to encourage our providers to write those maintenance medications that people are going to be on and are on monthly or on 90 days at a time. But if they are maybe testing out something for a patient and they don't want to give them 3 months, we'll still do the 30 days as well.
Well, and that's a very interesting comment that you made about testing meds out. By law, a pharmacy is not allowed to take medicines back to the pharmacy. Regardless of refund, it's not legal to return them to the pharmacy. You have to dispose of them yourself.
Correct.
So if you, as a patient, have had problems with medicine reactions in the past, would that be a good thing to share with your doc that's writing this prescription to try a new med? Let's just make it for 1 month instead of 3 to save that potential money?
Definitely. You don't want to get a 3-month supply on something that your doctor may change next month.
Because we're all different.
We are all different.
I hear that particularly with statins,
Yes.
okay, to lower cholesterol. Some people will say, oh, this one just, oh man, it made me sick and I changed to that one and it was wonderful. And their neighbor will say, I never had a problem with that one. So I think it's really individualized in terms of your reaction to meds.
Yeah, and a lot of times at the beginning, it's a good way for the doctor to keep up with the compliance again. The doctor will know at 30 days, I should hear from this patient or whatever.
So
I want to see
true.
how it's doing,
So
what
true.
kind of side effects they may be having, that type of thing.
Yeah, and certainly, no physician or nurse practitioner that I know of anywhere wants to give medicine to make you sick. The whole idea is to keep you healthy and feeling better, not the opposite. But because we are all individuals, sometimes that doesn't happen. And it would be okay then to call the doctor or the pharmacist and say, I've been on this 2 weeks and it does X, Y, and Z, and I don't want to take it. Can we have a substitute? Are there a lot of medicine substitutes these days, or is that like wishful thinking?
Oh, there's plenty of alternatives. One of the things they call it practicing medicine because they need to try things. That's the only way they know if it's going to work. Something may work great, but the side effect potential is too high. So they switch it to some other medication in that class that may have a lower side effect potential. So if they know, oh, this is working, but this is happening, we can kind of adjust that. Because when you said statins, there's several. There's probably 4 or 5 I can think of just right off the top of my head.
So would it be okay to call one of our pharmacies and talk about this instead of, quote, bothering the doctor? Because I hear that all the time.
Yeah.
I don't want to bother the doctor. They're too busy. Or I called twice and nobody called me back. Again, because they are busy seeing patients in the
Oh,
office.
absolutely. It's definitely, I mean, this is one of the reasons that we're here. We want to know what's happening. We want the patient in the community to be healthy. We want them to do the best treatment that they can, to avoid hospital stays, to avoid other doctor visits. And if we can say, hey, we can, connect you right to the doctor, or, that side effect will go away.
Because you could advise the doctor or advise the patient, like you say, maybe the side effect is pretty common the first couple of days until your body gets used to it or it gets absorbed in the liver or whatever fancy stuff it does.
Blood level may not be obtained until 10 days or so, so we want to know that.
Well, and that's another point. I often hear people say, I was better, so I stopped taking my medicine. How dangerous is that? Is it necessary to wean a lot of drugs, some of the drugs, none of the drugs, in terms of tapering off?
Well, a lot of drugs, it is necessary to taper off. But some drugs, if you stop immediately, you go right back to the potential or to the condition that you were at before you started.
Like anticoagulants,
like
perhaps?
Anticoagulants, definitely. Or blood pressure. A lot of people, I hear this one all the time. Well, I'm taking the medicine and now my blood pressure's fine, so I stopped. Well, maybe the blood pressure is fine because you were on the medication.
In other words, it's not going to correct some organ function indefinitely.
Correct.
It's an everyday or every couple of whatever hours or days that is maintaining that ability of your body to do that. Okay. I think that comes under health education, and I get the sense that you guys do a lot of that.
Oh, absolutely. Yeah, it's what we want to do for the patient. That's what the pharmacy is about. It's about understanding, making sure that the patient understands that, if you take this medication, take it at the same time every day. If you're on a water pill, don't take it at night because you'll be up all night going to the bathroom. If it's something that you need to take, try to do it the best way possible. It's going to avoid side effects. It's going to avoid spikes, peaks and valleys in your blood levels.
So can you help them if they had a problem with, the doc said I should take this in the morning with food, but I never eat breakfast? Are there workarounds sometimes that you can come up with to help people problem solve?
Yeah, absolutely. There are workarounds.
As opposed to saying, I don't eat breakfast, so I'm not going to take my medicine.
Yeah.
Yeah, it happens. I mean, we all have families. We hear these things.
And it depends on the person's situation. But yeah, we can figure out something. That's about, like you said, it's about education.
So I'm going to come back to the insulin thing because I think that's really, really important. Most of the folks that I know that are diabetics, insulin dependent, brag about it's so much easier than when I was first diagnosed because I have this little pen that I just crank the dial. Do you have discounted abilities for that?
With those, we would also suggest that the patient sign up for patient assistance.
Okay.
Because we do, however, get sometimes, as Ken stated earlier, those types of medications through direct relief. But all of
So if we get them at a low or no cost, we're passing that on?
We are passing that savings on. That is where the sliding scale comes into hand, with that discount that the patient will receive based on what level they are on that.
And so if they come to your window and say, I heard you on the radio and I really need your help with insulin, and they've not been a patient, making an appointment with a health navigator for a sliding fee scale assessment would be the first stop.
Yes.
Okay.
Yes.
But you'll help them until then with a doctor's prescription?
Yes, we will get...
I'm putting you on the spot here, aren't I? I'm sorry.
No problem. Once they see the doctor and the doctor writes them a prescription for that particular medication, we will then... we'll let them know what the price is without the sliding scale, encourage them to see the health navigator, to get on the sliding scale, and then from there, what we do is we get that paperwork started for that patient assistance program.
Perfect. And if they can't afford it, even on the sliding fee scale, particularly insulin, is there another alternative?
Yes, all of our not discounted, but all of our free meds and things like that are always on a while supplies last type of basis. So if we don't have any for free, we currently have different grants and things that we have gotten for the pharmacy that we will use to help the patient get their medication at least that first time.
So the key to this is getting to know your team at your local TCCH pharmacy.
Yes.
and being honest about what your needs are and what your concerns are.
Mm-hmm.
I know many of our elderly people take multiple medications, and they get those from multiple specialists. As a primary care provider, are you able, Ken, and the rest of the pharmacists to take a look at all of their medications and talk to them about potential conflicts? Because I know sometimes it gets a little confusing.
Yeah, we can see anything that they've done through the clinic.
Okay.
And then, of course, the big thing we try to emphasize is, are you on any other medications that you may get outside of TCCH? Do you see a specialist? Do you have over-the-counter products that you use? Vitamins?
Yeah, we don't think about those things often.
Yeah, and all of the stuff that, we'll ask, if you are on a blood thinner, do you take aspirin over the counter? A lot of people say, I take one because it says on TV I should take one every day.
Mm-hmm.
Well, it may not be a good idea to do so but if we need to know. So back to education. You're educating us as well on everything that you're taking when you come and talk to us.
So it's okay if they bring a bag full of medicine bottles instead of trying to write down those long, twisty names, and you'll just take a look at them?
Yep.
Okay.
Yep.
I just wanted to make sure. Mm-hmm. Full service is what I'm hearing.
And we're there for the community. We want to help as much as we can, and let us help you.
Okay.
That's the way.
You were saying that Eliquis is one of your most sought after drugs?
Eliquis is one of the most
My goodness, Ken, I'm so sorry. We're going to have you back.
Okay.
We have run out of time. I can't believe this.
Okay. That sounds fine.
Okay. Thank you both for being here today, and thank you, listeners, for being with us. I promise I will bring these two back at another time, and we'll have more discussions about pertinent issues that you may find helpful. Have a great day, and thank you again. Yeah.